Everyone wants a flatter tummy. We've all tried the crunches, but sometimes that just isn't enough. Well, today, Dr. Patty Flint is here, and she's going to help those of us who need a little extra assistance. We're going to try to figure out which way is better, right? There's a couple of choices that we have.
There are. Many times when I meet with patients, they're uncertain about what the best option is to accomplish their goals as far as the appearance of their tummy area. And I think the two major choices are between liposuction and tummy tuck. It can be hard for them to know exactly which procedure is going to be the best. The key indication is if you have extra skin, a tummy tuck will remove that, and liposuction will not. On the other hand, if your skin is pretty snug, but you have a little thicker layer that you don't like, then you're a good candidate for liposuction.
So the best way to know is that if we come in and see you, sort of measure us all out and see which way is the best way.
Definitely. I think when you meet with a board-certified plastic surgeon, they have the opportunity to hear what your goals are and then design the plan surgically that's going to obtain the goals that you've directed them for.
Okay. Well, you brought some before and after pictures.
I did.
And that's, a lot of times, that's sort of the easiest way to see what you're talking about, is to look at the pictures.
Exactly, because not only is there a choice between liposuction and tummy tuck, but there are different types of tummy tucks that are done that help patients obtain different goals. For instance, this photo shows a before and after picture of a woman that was a good candidate for a mini tummy tuck.
Okay.
A mini tummy tuck primarily affects changes in the lower portion of the tummy below the belly button. It doesn't have an effect higher up. But with this type of patient, a shorter scar can be used to tighten up that lower abdomen and remove skin below the belly button.
Okay. So that's a mini. What about this one?
This is more of a standard tummy tuck patient. I'm not sure if the viewers can see it really well, but she has stretch marks that extend all the way up above her belly button.
Oh, yeah, you can see it.
And some extra skin as well up there. So really a little bit longer incision suited her better. But as you may be able to tell, even though the incision's a little longer, it's nice and low, and she can still wear a small bikini and no one's going to know that she's had the work done.
Right, and it looks like it was just tightened up, and that's all a lot of us really want.
Exactly. This is a patient that obviously has more significant changes, particularly in the muscular layer of the abdominal wall. For some women after pregnancy, the tissue actually spreads out between the muscles that would be a six-pack, for instance, and that really takes away the girdle component of the abdominal wall. So even when she tries to suck her tummy in, she still looks fairly protuberant. So during a standard tummy tuck, we make a longer incision that allows access to repair those muscles that are no longer tight in the middle of the abdomen. So you can see she has a much nicer looking profile after those muscles are tightened.
Well, and something like this, it looks like no matter how many sit-ups she does, it's just not going to work.
That's absolutely right. You really can't bring those muscles back to the midline. You can strengthen them, but they don't work well as a girdle if they're living way out on the sides of your abdomen. So this procedure corrects that for her.
And this one?
This is the same patient in a slightly different view, and you can see how the incision does extend around the hip a bit, but with bathing suits that's easily covered, and it continues to fade over time. And we do take a very aggressive management approach to scars postoperatively to get them to fade more quickly.
Yeah, and there's a lot of products out there that can really just get rid of that scar.
Absolutely. This is also a more standard patient, slightly extended incision to help take away some of the extra skin that extends around the hip area, but she looks as if she's never had children and never been overweight after this procedure. So it was an excellent choice for her, and she's very happy with her result.
And this one?
That's that patient from the frontal view.
Oh, I would think these women would just be ecstatic.
They are. They are. It's very gratifying for them to actually hear that all the hard work with the gym and the dieting that hasn't paid off is not their fault, and it's correctable with these procedures.
Right. Well, what is the recovery time like?
It's a little different for liposuction and tummy tuck. Liposuction is done as an outpatient. I do use a general anesthesia so I can safely move the patient into different positions and give them the most thorough result. But that recovery is fairly brisk. Patients describe soreness, not a lot of discomfort, and they're usually up and about within a couple of days. With a tummy tuck, we do keep them overnight for safety reasons, and for about a week they need some assistance around the house. But by about 2 weeks, stamina starts to come back, and we get them back in the gym about 6 weeks later.
Perfect. And are you guys accepting new patients?
Yes, we are. Happy to see anyone that's interested in these procedures and many others.
All right. Well, obviously, these before and after pictures speak for themselves. You do beautiful work. There is a $50 consultation fee if you mention Health Zone, and you can bring a friend in for a consultation with no additional fee. And I guess we should say that this $50 can be applied to the surgery as well, correct?
Yes, absolutely.
All right. Thank you so much for
coming
in. All right, Dr. Patty Flint has 2 offices in the Valley, one in Scottsdale at 7301 East 2nd Street, Suite 200, and the other one is in Mesa at 1520 South Dobson Road, Suite 218. And you can reach her by phone at 1-877-91-FLINT, which is 877-913-5468, or online at pattyflintmd.com. Patty Flint, MD, is a sponsor of Sonoran Living Live.